think the patient demand informs where aesthetics is going. And sometimes that we lose control of that, and you see trends dictating how practice is delivered, or you see some fairly toxic influences, for example, social media and reality TV, determining where aesthetics is going. But I think we're kind of getting a handle on that, and I think we're becoming more aware of the kind of pitfalls that the industry has fallen into. So I think patients will always determine where the industry goes. Right now, there's a huge focus on injectables because you get these immediate results and consumers are very demanding. I think as they become more educated and as we become more educated, I think we will move towards more regenerative treatments. I think that the idea of injecting something that only has a volumetric change isn't going to be enough. I think we're going to want to biostimulate and actually regenerate tissues in our practice. I think we're also going to become a lot more holistic. I think injectors that are doing back-to-back lip treatments are going to fall behind. And I think that patients will demand clinicians that can talk about skin and devices and injectables all together. There's also the unknown factor. There are new technologies that are emerging all the time that stand to possibly disrupt aesthetics entirely, and we can never discount that, and we can never see where that's going. I think it's a really exciting time, and I think the future will get better and better for aesthetic medicine. One of the most important things at Harley Academy is that we've got to stay on top of the changes in the sector, and that doesn't all just fall on my shoulders. Fortunately, we have a really strong medical advisory board and full-time educationalists working in our team, and that means that we're constantly looking at the literature that's coming out, constantly working with the manufacturers and staying abreast of all of the developments that are happening so that our trainees can get the latest of aesthetic medicine when they train with us. My top tip for any healthcare professional looking to start in aesthetic medicine: don't build your brand around yourself if you can avoid it, because that's not scalable. So if you want to start a clinic, if you want to start a brand, it's better to use a new brand rather than your own name, because that's really not what you want down the line, because the more successful you'll get, the busier you'll get. And one of the most popular reasons for doing aesthetics, so I hear, is autonomy. And if you want your autonomy, you want a business that can run without you. So that's definitely one thing to think about. My second biggest tip is just don't give up. We've got a sector which is growing 20% year on year. So the consumer demand for good practitioners is growing so much that we can't possibly train enough healthcare professionals. So please don't be put off if you see a lot of local injectors and a lot of competition, because I promise you the consumer demand is there. And if you work to differentiate yourself, if you work to really become a specialist, which takes time and sacrifice and investment into this career, into studying, then you will be able to stand out and you will be able to build your career. And that just requires a lot of perseverance. It doesn't happen overnight, but I don't know anyone that hasn't worked hard that hasn't ultimately achieved a successful career in aesthetics.